Now we are going to discuss about the brachial artery. So you can see here this is the brachial artery. Actually this brachial artery is nothing but the continuation of axillary artery. So if you see here the axillary artery, of course axillary artery is in turn a continuation of subclavian artery. So according to the location the artery name is changing but the artery is same everywhere. For example, if you see the subclavian artery, it is around the clavicle, so it's called subclavian artery. And axillary artery, as it's in axillary region, so axillary artery. And brachial artery, as it is in arm region, so brachial artery. Next, this brachial artery in turn divides into radial artery and ulnar artery, because on ulnar side ulnar bone, right, so ulnar artery. Radial side thumb side radial bone, so radial artery. So just according to the location the artery name is changing but the artery is same, which is starting from this subclavian part, you can see here, right. So this is a continuation of axillary artery. Mainly if you want to talk about brachial artery, then you will say it is a continuation of axillary artery, right. It extends from lower border of teres major, right. It extends from lower border of teres major muscle to a point in front of elbow at the level of neck of radius. So at the level of neck of radius, right, just medial to tendon of biceps brachii. You know, tendon of biceps brachii will be attached to radial tuberosity, so just medial to it this brachial artery will divide into the radial artery and this brachial artery will divide into radial artery and ulnar artery, right, at the point just medial to the tendon of biceps brachii. So now let us understand its course and termination. So brachial artery mainly begin at lower border of teres major muscle as a continuation of axillary artery. Next it runs downward laterally. It runs downwards and laterally, right, in front of arm and crosses the elbow joint. It ends at the level of neck of humerus in the cubital fossa. This is called as cubital fossa by dividing it into two terminal branches. So what are the terminal branches of brachial artery? Nothing but the radial artery and the ulnar artery. So relations are, this runs downwards laterally from the medial side of the arm to the front of the elbow. So actually it runs downwards laterally from medial side of the arm. If you see the medial side of the arm, it will run laterally from medial side of the arm and moves to the front of the elbow, right. It is superficial throughout its extent and it is accompanied by two vena comitans. Anteriorly in the middle of arm, it is crossed by median nerve. So anteriorly in the middle of arm over here, it is crossed by median nerve from lateral to medial side. Actually median nerve first will be in the lateral side, so from lateral to medial side the median nerve will cross it at this region of brachial artery, okay. And next, in front of elbow, it is covered by bicipital aponeurosis and the median cubital vein. Already we know about median cubital vein, and remember that it is also covered by bicipital aponeurosis. And posteriorly, it is related, of course, to the triceps brachii and the radial nerve and the profunda brachii artery. Always remember the radial nerve is backside and also the profunda brachii artery is the artery of backside or the posterior compartment of the arm. Next, coming to medially, if you see medially, especially in the upper part, so this is medial side, right. So medially in the upper part, it is related to ulnar nerve. Why ulnar nerve? Because medial side ulnar nerve, right, and also the basilic vein, because you know basilic vein is on the medial side and the cephalic vein is on the lateral side. So basilic vein and also the ulnar nerve are related to the medial side of the brachial artery, okay, and that is in the upper part. But in the lower part to the median nerve. For the lower part, it is related to the median nerve. Once again, I will say the upper part medially is related to the ulnar nerve and also basilic vein, whereas the lower part is related to the median vein. And laterally, it is related to the coracobrachialis and also the biceps brachii. Remember, laterally the brachial artery is related to the coracobrachialis and biceps brachii and the median nerve in the upper part. So as I said, the median nerve first will be in the upper part lateral side, but later it will turn towards the medial side in the lower part. So if anyone asks what is the relation of brachial artery on the lateral side, then you will have the median nerve, but in the lower part on the medial side you will have the median nerve. That is the logic to understand here, okay. And tendon of biceps brachii is seen laterally to the brachial artery in the lateral side, okay. Next, coming to the elbow. At the elbow, the structures from the medial to lateral side are. So at the elbow, what are the structures from medial to lateral side? Let us understand. So on the medial side, first you will have the median nerve, because the median nerve is coming laterally from the upper part to the medially like this, right? So here, so medially first you will have the median nerve. Next you will have the brachial artery, right? After brachial artery you will have biceps brachii tendon, because as we discussed, the biceps brachii tendon is lateral to brachial artery, okay? So after biceps brachii tendon you will have the radial nerve on the deeper plane. That is because why radial nerve on deeper plane? Because radial nerve is on the posterior side. So remember all the structures, you have a mnemonic like MBBR, not MBBS, MBBR. MBBR means first M stands for median nerve, okay? Next B stands for your brachial artery. Next B stands for biceps brachii tendon, and R stands for radial nerve on deeper plane. So MBBR, median nerve, brachial artery, biceps tendon, right? And R for radial nerve. Done. So let us see what the branches of brachial artery. The unnamed muscular branches are present, and also the profunda brachii artery lies just below the teres major and accompany the radial nerve. Remember, profunda brachii artery on the posterior side will accompany the radial nerve, okay? And the superior ulnar collateral branch arise in the upper part of the arm and accompany the ulnar nerve. It will accompany the ulnar nerve on the medial side. The nutrient artery is given off to the humerus, and the inferior ulnar collateral or supratracheal branch arise in lower part and takes part in anastomosis around the elbow joint. So I will talk about elbow joint anastomosis later. Just remember that this inferior ulnar collateral or the supratracheal branches arise in the lower part and take part in anastomosis around the elbow joint, okay? And the artery ends by dividing later into terminal branches, that is the radial branch and the ulnar branch. That's it. So the only logic here you need to understand is about the median nerve. The median nerve first starts laterally. The name is median nerve, but it is starting laterally. Next it winds around and comes towards the medial side. Only that thing you remember. And also remember this mnemonic MBBR. That is the structures in the elbow from medial side to the lateral side. Other all are just according to the diagram, you can easily get them. So now we'll understand the anastomosis around the elbow joint. So actually the anastomosis around the elbow joint, it's better to see in the textbook itself the diagram, right? So this is a anastomosis around the elbow joint. It looks like hard, but it's simple. It mainly links the brachial artery with upper ends of radial and ulnar arteries. So for example, as we said, the brachial artery is divided into radial artery and ulnar artery, right? So here exactly at this elbow, the brachial artery will give some branches, right? That branches will come in anastomose here, and the radial and ulnar artery will also give branches, right? So all those branches will come in anastomose over this elbow joint. So till now in this upper limb we have seen three anastomoses. One is around body of scapula, one is around the acromion process, and now we are talking about the elbow anastomosis. So in elbow anastomosis, the brachial artery from upper side is involved, and the radial artery, ulnar artery from lower side are involved. So exactly at this point, so if you zoom that, you will be seeing like this, right? So it supplies the ligaments and bones of the joint. The anastomosis can be subdivided into following parts. So in front of lateral epicondyle, so first we need to see what is the lateral side and medial side, right? So if you get the word ulnar artery means it is a medial side, so like that you can easily find out, and this is the lateral side, okay? On the medial side, mainly in front of lateral epicondyle, in front of lateral epicondyle on lateral side, right? In front of lateral epicondyle of humerus, the anterior descending radial collateral branch of profunda brachii anastomose with radial recurrent branch of radial artery. So actually there is a mnemonic to remember this, that is SIMR PAIR, that is from medial side to lateral side, right? So S on medial side, the first one is superior ulnar collateral artery. One thing before starting this, you need to understand what is collateral and what is recurrent. So collateral is the flow of blood which is from the upside to downside, that is the collateral flow. If the blood is flowing from downside to upside, that is in opposite direction, then it is called as recurrent, right? So now we were going to discuss both the collateral and recurrent circulation here, that's why I'm mentioning this. So mainly from medial side, remember the SIMR pair, okay? this is SIMR. SIMR means S, first from medial side to lateral side I said. S means superior ulnar collateral artery. Okay, did you see this? Okay, and next coming to I. I means inferior ulnar collateral artery, right? So if you see here, this supratrochlear is also nothing but inferior ulnar collateral artery. Okay, that's one. And next comes the M. M is for R. So it's middle collateral artery, or nothing but the middle side you have the brachial artery, right? Middle collateral artery. And R stands for radial collateral artery. The radial collateral artery will be this side. This is a radial collateral artery. So SIMR, it anastomoses with PAIR. So what is the PAIR from medial to lateral side? Let us see. P stands for posterior ulnar recurrent artery, and A stands for anterior introitious artery, right? And I stands for introitious recurrent artery, and R stands for radial recurrent artery. So now let us see how they are going to anastomose. As according to this only, S anastomose with P. S means superior ulnar collateral artery, anastomose with P. P means what? You can see here, this is a posterior ulnar recurrent artery. Next, I anastomose with A. I means inferior ulnar artery. You can see the inferior ulnar artery, anastomose with A. A means anterior introitious artery. You can see here, this is a anterior introitious artery. Next, M. M means middle collateral artery. Middle collateral artery, anastomose with I. I means introitious recurrent artery. You can see here. So these are all the recurrent. The lower one are all recurrent. The upper one are all collateral. Next coming to R. R means radial collateral artery. So the radial collateral artery will of course anastomose with radial recurrent artery. This is radial collateral artery. This is the radial recurrent artery. So just by this simple mnemonic, your elbow anastomosis will be in your tips. SIMR, PAIR. Remember to write medial side to lateral side. So always remember to write on S side. S is medial, R side is lateral. Okay. So just by this we completed our elbow anastomosis, elbow joint anastomosis. Next we'll start with the large nose.